the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar, and then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We're always with you from start to healing!
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya. By accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So hindi niya na nararamdaman na may natapakan pala siya. So probably yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So nagkaroon siya ng lagnat on and off, nakahiga lang siya. So sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami na komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon, nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi, dahil nag-pick yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos, yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo na ako binayaran So it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? Dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously despite medyo may konting kamahalan, but then kung titingnan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS, and I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Nur Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, gano'n. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. At Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
And we are live. Today, everyone. My name is Jhen Lim, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. We are an international distributor of food supplements made from a unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. Tonight, we are diving into a crucial topic: kidney health and chronic kidney disease. You know, CKD is a silent but serious condition affecting millions worldwide. The good news, with the right lifestyle choices and targeted nutritional support, we can help protect our kidneys and even slow down CKD progression. To shed light on this, we are honored to have 2 esteemed experts with us. First, we have Mr. Shyan Lim, as he's an international speaker on personal success and healthcare. He is also the founding director of Simply Nature International and our PPARS expert from Singapore. Good evening po, Sir Shyan.
Good evening, Jen, and good evening to everyone. Tonight we're going to talk about CKD. I just came back from Singapore, And the general, and when we talk about health in Singapore, one of the growing trends and concerns is actually chronic kidney disease. So CKD wasn't the hot topic. You know, in the past it was dialysis, and in Singapore they have many charity shows to raise money for dialysis. So most of the time we hear dialysis, right? We hear kidney failure, but right now in Singapore, what we are hearing from the ground is actually CKD. So that's actually before kidney failure. So what's happening in Singapore is that a lot of people are developing CKD. And I think here in Philippines, that's also the case. We're very fortunate that tonight we actually have Dr. Jansen, who actually has quite a few CKD patients. So those of you who have any interest in this area, and I'm sure you do, or else you wouldn't have come for tonight's program. Stay tuned for the AMA after the discussion. That's Ask Me Anything segment. You can always ask your usual cancer questions, but tonight the focus is on CKD, so you can also ask that, and Dr. Jansen is perfectly suited to answer your questions. So I'll hand the time back to Jhen, who will introduce tonight's discussion, and I'll see you all in about 15 minutes time.
That's right. Thank you, Sir Shyan. Joining us as well is Dr. Jansen Kalalan, a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine, and an expert in integrative oncology. He currently serves as a consultant at Alta Integrative Medicine, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Let's all watch this.
Hi everyone, I'm Shan and welcome to today's Simply Nature webinar. We're so excited to have you here. If you or a loved one is struggling with high creatinine levels, kidney disease, or poor kidney function, then this session is for you. Let's start with a quick question. Do you or someone you know have high creatinine or are dealing with kidney health issues? Type yes in the chat if this is something you're facing. So what is creatinine? Right? Creatinine is a waste product filtered by our kidneys, and when levels are high, it means your kidneys are struggling. Left unchecked, this can lead to chronic kidney disease, dialysis, and even kidney failure. Here, I want to talk on a personal note. Why is kidney failure scary? Or why CKD is terrible? And why do you want to avoid dialysis, apart from the fact that it's very, very expensive in the long run? Okay? The reason is because your kidney is one of those organs in your body that cannot regenerate. Right? Do you know that if you cut out half your liver, in about a year, the entire liver grows back? But when it comes to kidneys, once your kidney cells are destroyed, and these are called nephron cells, once cells are destroyed, they never grow back. It can't be regenerated, which is why kidney failure leads to dialysis. And here's the scary thing, dialysis leads to a shortened lifespan. On our Simply Nature webinar, we often talk about cancer and how cancer patients struggle to hit the 5-year mark where they are now cancer in remission. Now, the scary thing is if you're on dialysis, it's the reverse. Your life is probably shortened, could be shortened to 5 years. Just do a simple Google search and you will see that the life expectancy of a dialysis patient drops to as low as 5 years. And this is something that scared me personally too, because there was a period of about a year where work was very stressful because of people like Junie and Sheila, you know. And I was actually having a little bit of a high blood pressure, and that worried me because I know high blood pressure can damage your kidneys. So thank goodness I often go for a test. I test for my GFA, and good news for me is that my GFA is normal. So despite the high pressure, my kidneys are still functioning normally. Right? So it is very important to make sure that your kidneys are healthy, especially if you want to live a happy, long life. Now, here's the good news today. You can support your kidneys naturally. And today I'm going to share with you how Simply Nature PPARS can help you lower your creatinine levels and support kidney function. Let's go back to some technical stuff, all right? Why is high creatinine dangerous? When your creatinine levels are high, it means your kidneys aren't filtering the waste properly. So the creatinine levels is like the residue, right? It's an indicator. And this can be caused by many factors. Number one factor is diabetes. It's a leading cause of kidney diseases. So many people at the dialysis center are also diabetic. Hypertension, that was the one that I was worried about, right? It's because high blood pressure damages your kidney function. Just imagine, very easy to understand. If your water pressure is very high, your water filter gets stressed, right? Because the water is pushing through the filter too quickly, too hard, and that damages your filter. So the same thing works in your body for your kidney. Inflammation and oxidative stress. So when you're inflamed, your blood has more compounds that the body needs to filter. And of course, inflammation also leads to higher blood pressure, right? It creates blockages in your arteries. It causes the arteries to get clogged up faster, and that leads to hypertension. And hypertension again goes back to creating stress for your kidney. High protein diets and medications toxic to the kidney. High protein diet is like putting sand in your water filter. Can you imagine you have high water pressure and you put sand? That's gonna be like a super abrasive on your water filter, right? So high protein actually like creates lots of residues that has to be pushed through the filter. So it's like eroding your kidney filtration filters, right? And that's how high protein diets are actually very stressful for your kidneys. So here's the thing. Most people don't notice their kidney functions declining until it's too late. By the time creatinine levels rises significantly, up to 50 to 70% of the kidney function could already be lost. Now, remember, whatever kidney cells that are destroyed cannot be repaired. So if you lose 50%, you lose 50% forever, all right? It's not like after that, if you go on a good diet, just like, when you get fat or you got high cholesterol, you change your lifestyle, your cholesterol comes down, you slim down, you go back to a normal, healthy life. For kidney failure, it's not like that, right? Even if you become you change your lifestyle, you become very health conscious, you become healthy, guess what? Your kidney function is still at 50%. It's just that it doesn't get worse, that's all. You can't bring it back up. So that's how serious CKD is, all right? And even today, the videographer for the program today is actually Nate. So Nate has a very personal experience with CKD because he's a good son. He was about to donate his kidney to his dad. By God's grace, there was a donor, so he didn't have to do that. But again, that was a very big decision for Nate, because you can't grow another kidney. And if he doesn't take care of his kidney, right, the kidney function cannot go back up. I just want to highlight something hopeful for everyone. All the doctors will tell you, if your kidney cells are destroyed, you can't grow new ones, all right? But here's a ray of hope. Before your kidney cell is destroyed, so when it is damaged, it can be repaired. But if it's destroyed, it cannot be replaced. So even for persons like Nate, because Nate shared when he wanted to donate his kidney to his dad, his kidney functions were not optimal. But they could be improved with his lifestyle. Why? Because the cells were not destroyed yet. The cells were not destroyed yet. They were damaged, but they were not destroyed. But once they are destroyed, you cannot make new ones. Okay? So today, our hope is that you can actually, with Simply Nature PPAR protocols, find ways to rehabilitate and repair your kidney cells before they get destroyed. So how can Simply Nature PPAR help with lowering creatinine naturally? The answer is in cellular healing. And this is where Simply Nature PPAR comes from. So, like I said just now, heal it before it's destroyed. Because if it's destroyed, your body can't make new ones. Okay? PPARS helps in 3 key ways. Number 1, it reduces inflammation. We talked about inflammation just now, right? Inflammation causes stress, increases hypertension, and that will directly lead to damage in your kidney cells because of the high pressure. And also inflammation means there are more residues. I'm using layman terms. These are not medical terms, all right? There are more residues or items floating in your blood because of inflammation. And these are going to be like sand that you throw in your filter, right? So that's going to wear and tear your kidney faster. So that's why reducing inflammation is very important. And that is why having chronic inflammation in your body, and many people after COVID-19 have long COVID syndromes, right? And that's actually chronic inflammation. And that's why nowadays more and more people have CKD problems, liver problems, heart issues because of the constant chronic inflammation. Number two, we can enhance kidney filtration, okay, by preventing the creatinine buildup. And the third one is boost cellular repair. So basically all these three ways that Simply Nature PPARS can help your kidney function is interrelated. All right, you do one, you actually help with the other portion, right? If you reduce the wear and tear, you make it easier for the repair, right? As you repair, you undo the damage from the wear and tear, right? So, and then if you get rid of the root cause, which is your inflammation, then you have less to repair and easier to maintain. So these three literally work in synergy together. So we've seen many cases where patients with high creatinine, some even advised to prepare for dialysis, were able to stabilize and improve their kidney function after using Simply Nature PPARS. So Dr. Jansen hopefully will be joining in the AMA segment after this. He will share with you, he is like super confident. Dr. Jansen is super confident to delay dialysis. That means with all his patients with CKD issues who are on the way to hitting the need for dialysis, he is super confident that he can delay the onset or the need for dialysis. So many of his patients are able to delay dialysis by a few years. Now that's like literally adding a few years to your life, and not just adding life, but adding quality life, because your kidneys are still functioning. They're able to delay the damage. Now, why do I talk about delay and not cure? Because we need to know each and individual case, whether it can be reversed or not, or have you crossed the line of no return where the kidney cell is actually destroyed. Like I said, if the kidney cell is actually destroyed, you can't create new ones, right? So it really varies from individual to individual basis. So I'm giving you the worst case scenario. Worst case scenario, if you really have a serious CKD, we can delay the onset of your dialysis. And if you're already on dialysis, here's the good news. Here's the good news, right? I was in Taiwan at our factory, and I was talking to the general manager, and I was talking about CKD, and he gave me a wonderful testimony. There is a client who has been on dialysis for more than 30 years, right? You heard me right. When you Google, you will see if you're on dialysis, your life expectancy could cut to 5 years. This particular person has been on dialysis for 30 years, and the good news is he's been eating normally. Many people who are on dialysis have very, very, very restricted diets. So this person is eating quite normally, not extravagantly, all right? It's not the license to eat whatever you want, but he's been able to enjoy the good food in life as well. And he's been on Simply Nature PPAR tablets. Okay, he has been on the tablets for more than 30 years, and that has assisted him. So to all the patients out there at dialysis centers, to all those who have been told that you have to go on dialysis, here's the good news. Simply Nature PPARS will be able to help you go through your dialysis so that your life expectancy does not drop to 5 years, so that you have quality of life, and that there is hope of a full life, able to enjoy food, good food in moderation, and also live out your full long life. All right? So again, if you're worried about high creatinine levels and want to prevent further kidney damage, don't wait until it's too late. The earlier you take action, the better your chances of recovery. And your kidneys are vital to your health, and you deserve the best natural support to keep them functioning well. So take action today, because your health is your greatest wealth. Thank you for joining, and we look forward to helping you on your health journey.
We have it. What an eye-opening discussion. Kidney health is truly a priority. And as we've learned today, lifestyle medicine can be combined with science-backed nutritional support like PPARS, can play a vital role in kidney protection and CKD management. I know you must have lots of questions, so now it's time for our much-awaited live AMA or Ask Me Anything portion. Drop your questions in the comment section, and we will try to answer Mr. Shyan Lim and Dr. Jansen. Before we begin, let's just give a big shout out to our loyal viewers, Miss Helen Camonain from Baguio, Miss Janet Ku from Child House, Sordelina Cura, and Nomi Veras from Bicol. Good evening po, gentlemen.
Good evening. So good to see you, Doc. Yeah.
Good evening. Hello.
You're the important expert today because you've actually had many CKD patients, and Doc, you've actually successfully delayed a few CKD patients' dialysis. So all these are great experience and testimony. So Jen, let's go into the questions.
Yeah, I can see lots of questions coming in. So let's start the live AMA. First question coming from Facebook, Ma'am Evelyn Dalming. Good evening. Oh, why does the PPARS tablets taste fishy?
Okay, I'll answer that question, Doc. Actually, it doesn't taste fishy, okay? It tastes like algae. So maybe it's a taste that we always associate with like sushi and things like that. However, the taste of PPARS actually differs based on the patient's, the person's health, right? So actually, if you are a cancer patient and you're undergoing treatment, it might even taste metallic. For me, I think the PPAR tastes like green peas, okay? I just ate some just now. So just to confirm, yeah, it still tastes like green peas to me. Okay, so Doc, do you have any experience different patients having different taste of the product?
Well, they haven't told me any that, but basically, in terms of taste, my patients can be classified into two: those who love it and those who don't.
Okay. So for this particular viewer, there's no specific reasons that we don't grow it near any fish or anything. All right, it's an aquatic plant, so maybe some of the tastes that you associate with fish, aquatic source of food, maybe that's where the similarity comes from. But honestly, personally, for me, it tastes like mongo, right? It tastes like mongo. Yeah.
Yeah. Mom, it's okay if you don't chew it. You can just swallow it with
Yeah, you
water.
can just swallow it, all right?
or-
My wife always persuades everybody to chew it, but I swallow, I don't chew it. But
Mm.
I know what it tastes like because I do bite into it, I just have to try too. Yeah.
Okay, next question thrown to us privately from Rio. Can PPARS help with my edema and urine output?
Oh, that's interesting, Doc.
We have to first know the reason why you have those. Yeah, because urine output and edema, these are symptoms of a lot of different issues. Can be because of the kidney, can be because of the heart, can be because of the liver. It can be none of these, and just because of the venous insufficiency or the integrity of the blood vessel is not good. So we have to find out those first before we make or before we make recommendations if whether PPARS would help or not. But in general, PPARS would generally help because it can lower inflammation, all these things, give you proper nutrition. But again, it's just part of the it's just part of the bigger picture. Okay, so I have to know why you have these why you have these in the first place. Yeah, so I'll give you an example. Swollen feet because of a wound. So I think it's one of the patients of Simply Nature, not my patient personally, but one of Simply Nature's patients, right? So diabetic foot ulcer. So since it's a wound, it's non-healing. The whole feet of the patient was swollen. Now I think the patient started on Simply Nature PPARS, then the wound started to heal slowly. So edema eventually resolved. The wound closed completely. So so we have to know these things first, so before I can tell you if it will work or not.
Yeah, I want to add to this is that, as Dr. Jansen says, the PPARS will help you in general because it helps with the basic things like metabolic syndromes and inflammation. So what Dr. Jansen said is, I think, really important. If you have edema, there's another problem, right? So I think that is a very good advice from Dr. Jansen. Let's find out what your other problem is So edema by itself is not the real issue. So what's more important is that we find out, we clearly identify what your medical issue is and how to treat that. So for that, please have a consult with Dr. Jansen. So I always want to bring this up during our programs. One of the wonderful things about what the pandemic gave us is that the pandemic made it normal to have online teleconsult, right? So it's really, really good, especially the traffic has come back in Philippines. Doc, do you suffer from traffic in
I
going
do. I do. I mean, a while ago, I went to different clinics. So yeah, it was the traffic jam is bad today actually. Yeah,
Yeah.
so I am affected by these traffic.
Yeah, so one of the things that really tire a patient out is, especially if you have an issue, but it's not like really affecting your life immediately, and then you have to go to work, and sometimes we're just too tired to go and figure out what's wrong, right? Or so the beautiful thing about teleconsulting is that you can start your initial consult with the doctor from the comfort of your own home, and usually at a timing that you can manage. Sometimes even in office hours, if you could have an early lunch so that you can come back at a time where you can arrange so that even during work hour, you may be able to take 15-20 minutes out, right? You can do your work first and then tell your boss, and then you say, I need to have the teleconsult. I'll shift my lunch hour to 2 o'clock. I work through lunch. So that will allow you even at work to be able to consult a doctor without having to spend 3 hours in traffic, parking, or transportation. So please, to everyone, do avail the availability of Dr. Jansen for teleconsultation. Okay, yeah. Jen, you want to
Okay.
tell how do they consult with Dr. Jansen?
Okay. For those of you who wish to have a consult with Dr. Jansen Kalalan or any of our many PPAR partner doctors, you can schedule an appointment using the link in the description box and comment section below. Our pretty and caring healthcare specialists, Miss Beth and Miss Irish, will reach out to you shortly. And Mom Evelyn commented again saying, "Thank you. I just started my PPARS tablets and it's nice joining your webinar."
Nice having you with us, Evelyn.
And
No, I feel like today the mood is lighter because we're not talking about cancer yet.
Yeah, not yet. Well,
Ah,
CKD is also a
yeah,
heavy topic, but
yeah, but
I think I should let you speak more than me.
please
Okay.
carry on.
Before we move on to our next question, let me just give a special welcome to our new viewer, Miss Melinda Seville. Welcome po to the program. Okay, next question, thrown to us privately again from Miss Helen. I have high uric acid. What PPARS product can help me?
Start with the tablets first. Start with the tablets. Make the necessary lifestyle changes. Then we go from there. If you need a higher dose, then we can add in the soft gel. But for high uric acid, no, the food that you're eating is the most important. So foods that can increase your uric acid would be sweetened beverages, your innards. By innards, that would be your liver, your kidney, your lungs. So Filipinos love these foods. Intestines as well. Okay. Yeah. What else? Seafood is also notorious for increasing uric acid. Um, Soft drinks. Yeah. So that's part of sweetened beverages. What else? What else? What else? What else? Yeah, I think those are the ones that you have to be um wary of, no? Yeah.
I just want to affirm Dr. Jansen's recommendation. Yeah, the tablets should be more than enough. Your uric acid should come down within a month. This actually happened close to me because my brother-in-law actually had uric acid, and because of the uric acid, he could not pass his insurance medical examinations, right? So he couldn't even get his insurance. So he was on the tablets for 1 month, and when he went to do his test again, everything was normal and he was able to get his insurance plan. The good news is that, alcohol will also add to the uric acid, right? My
Yes.
brother-in-law drinks like 4 bottles of Red Horse every night. Okay, the equivalent. But one of the nice thing is that because Simply Nature, I don't know, it maybe revitalizes the liver. But after 1 month, he starts to drink less because he gets the same high and kick after 1.5 bottles. So his wife was happy because he drank less after that. So yeah. So for this particular viewer, start with the tablets, right? Yeah.
Okay.
Oh, okay. If you're starting the tablets, I would suggest, if you really want to see quick results, I would suggest 10 micro tablets 3 times a day, or 15 micro tablets twice a day, whatever is easier for you to comply with. All right. But take at least 20, 25, 30 if it's possible. Then you will see the results much faster, and and you will feel it too. So because those with uric acid, you might suffer from gout and other issues as well. All right. So you will feel it also.
Okay, thank you, Sir Shyan. Thank you, Doc. We have some leftover questions from last week's webinar. It's from Ma'am Mirna from Santa Rosa, Laguna. Can my husband take PPARS tablets while undergoing chemotherapy? He has rectal cancer and taking oxaliplatin and
Oh, wow.
Yeah,
capecitabine.
it can be. Actually, PPARS have been studied well with, at least Simply Nature PPARS, it's been studied with oxaliplatin. For capecitabine, there are third-party studies on that. So capecitabine actually enhances the effect of PPARS. PPARS also enhances the effect of capecitabine, and it can help with the side effects. So yeah, while your husband is on chemotherapy, definitely you can let him take PPARS. Yeah.
Nothing to add. Perfect answer.
But for cancer, not only PPARS tablets, also include our extracts like
Yes,
PPARS
yes.
liquid.
Definitely. Extracts would always be needed for patients undergoing well, for cancer patients in general, no, it's just a matter of choosing the right extract for you. But if you can afford it, definitely go for the liquid, because that's the most powerful one, and that's usually the most how should I say? Should I say magical? Because
Yeah.
patients almost always feel a dramatic improvement, no, in terms of their general sense of wellness. Yeah, so go for the liquid if you can afford it. But say for example, if you have some difficulty swallowing, have some ulcers, oral ulcers, then that would swallowing liquids would be more difficult. So you can go for the soft gel as well. No, yeah. So um, one of those extracts. No, but if you can afford it, go for the liquid always.
Okay, thank you, Doc. There's a question from Facebook, Ma'am Bing Bing. Good Eve, what kind of PPARS is applicable if you have cyst in the kidney, liver, with prostate, and there's also a scar found in the lungs, but it's small, found in the CT scan? What PPARS is best for him? Thank you, po.
But what kind of condition?
I would almost
result in
wait. Those are usually incidental findings.
okay.
Those are non-specific. So I would say that those are not dangerous. Since they are incidental findings, no, not life-threatening at all. But if you just want to make them disappear, best bet would always be the liquid. Yeah.
Yep.
Okay.
Another sustainable one is if the liquid is something that is if you have any budget constraint, and since it's life threatening, you can also consider the powder. But I agree with Dr. Jansen. The best is always the liquid for any growths in your body.
Yeah, in her question, there's a cyst in the kidney, so hopefully the creatinine levels are normal naman. And for the liquid. Okay, next question from a leftover from our previous webinar. Ma'am Lenny, a housewife from Mandaluyong. Are the products good only for cancer patients? Are the products safe to use for people with anxiety disorder, hypertensive, and diabetes?
Okay, let me answer, and then Doc can do any medical things that I missed out. Okay, the answer is yes. I just want to let you know I have no cancer, and I've been eating PPARS since I was 27 years old. I'm 51 years old this year, so I've been eating it for 24 years. So one of the benefits that I'm sure, since this is a lady, that you will be very interested in is that PPAR has a very strong longevity effect or anti-aging effect, right? Because one of the functions, it preserves mitochondrial function, and that actually gives you, number one, just energy in general, and that gives your cells, I guess, vibrancy, and that is part of anti-aging. It works for all the metabolic syndromes. It helps to manage your blood sugar, blood cholesterol, and these two are incidental or affects hypertension, because hypertension is hard to pin down. It could come from stress, and in my case, Dr. Jansen will always tell me, sleep more, Shyan. I don't sleep enough, so that's one of the root causes for hypertension as well. So all this is going to be helpful for you. So yes, you can use it. There was one more part of the question. Did I miss something, Jhen?
Anxiety disorder.
Yeah, anxiety. Yes. Very important. Very interesting. I just had a conversation with someone about this. I think all brain disorders or any mental stress will also cause neural inflammation, right? So a build-up of increase of neural inflammation can lead to different kind of brain disorders or emotional states. So I would like to confirm that there are patients like schizophrenic patients, ADHD, autistic patients, when they take the PPARS, tablets, just tablets, and soft gel and tablets, depend on the severity. What they do experience is calming down, right? It may not solve your anxiety completely, because that has many root causes, including how you manage the triggers for your anxiety, but it does have a calming effect. Doc, very interesting. I actually had a patient who took the product for blood sugar, and then they called us to tell us they were able to go off Prozac. So that's just very interesting. Back then, we had no idea about this neuroinflammation. Yeah. Doc, you have anything to add?
Yeah, so for conditions like that, no, hypertension, diabetes, it's always important to be able to reverse these two, because these two almost always leads to other complications. No, that's part of the top 10 causes of death of humanity. Okay. Now, yeah, anywhere in the world, regardless of the country that you're living. So these two diseases. Now, of course, you still need to take your medication. So PPARS is not a medication. Still need them. Do you need to make the necessary lifestyle changes? Yes, of course. Why do you need to do so? Because if not, then the PPARS will be useless. Okay, we won't be able to reach the goal that we want. So the role of PPARS here in this context, no, is to accelerate the improvement in your health with the necessary lifestyle changes. Okay, but again, medications would still be necessary, at least for the first few months. I would say months, because hypertension and diabetes are diseases that's not easy to reverse. No, the ability to, or the reversible. Yeah, I don't know if there's such a word, but the reversibleness. Okay, the reversibleness of hypertension and diabetes largely depends on how motivated the patient is.
Yeah.
Not really the ability of the doctor, not really the medication, the efficacy of the medication. It's on the motivation of the patient. If you are motivated enough, you'll be able to make the necessary lifestyle changes, and eventually you'll be able to be weaned off the medications. So, PPARS you can use to accelerate the process. Yeah.
Doc, you mentioned about this. So there are many people who are not motivated, and for example, they use their maintenance drugs to maintain their blood sugar level and cholesterol level. So what happens over the long run is that dosage of their maintenance drug keeps increasing, right?
Yeah.
Because their lifestyle. They don't change their lifestyle. They say, as long as I take my metformin, my blood sugar is okay. So actually, year after year, the metformin dosage actually will start increasing.
Yes,
Yeah,
absolutely.
It's even their
absolutely.
excuse, sir.
control blood sugar, blood cholesterol through medication. It's
Mm,
like it will work very consistent.
mm,
So it gives you the illusion that things are okay, but your dosage
mm.
is actually increasing and things are actually worse, but it's just that you don't feel it, right? So anytime you run out of medication, or worse, if you develop another illness, right, the underlying problems are all there and it's just going to compound. So we will strongly encourage you do lifestyle change, and yes, the PPAR tablets is going to really accelerate and help you achieve that reversal and being off maintenance in the long run. I would say 3 months, right? 3 months, you would actually become normalized unless your lifestyle absolutely got worse, or your blood sugar has genetic issues. Like, for example, if you're type 1 diabetes, then it might take longer than that. Yeah.
Okay, next question coming from Maria Rosalie, a nurse from Batangas. Her question is, can glutathione help in cervical cancer?
Okay, for glutathione, it should not be given left and right to cancer patients. Okay, because cancer actually utilizes glutathione to protect itself.
So it can actually help the cancer. I mean, it
Yes.
make the cancer worse. Yeah.
Yes.
Wow.
So, when in a cancer patient, when do you use glutathione?
Okay,
You only use glutathione if the cancer patient is undergoing either chemotherapy or radiation therapy. Only these two.
Also, you shouldn't take it on its own. It is never like a treatment protocol or even a support protocol for a cancer patient, but instead it's a support protocol for chemotherapy.
It's a support protocol. Yeah, it's a support protocol for the chemotherapy side effects. So in that sense, then you can use glutathione. So in what context can we utilize glutathione? Say, for example, your inflammatory markers are high. Your ESR, LDH, HSCRP are all high. These are markers of inflammation. And if these are high, the tendency for the cancer to be the aggressiveness of the cancer is also quite high. It's also quite aggressive. Okay. So now you would want to lower these down, no? So these are inflammatory markers, and glutathione would be able to help lower these down. Now, glutathione can also be used in a cancer patient who is already in remission. Now, there are cancer patients who are, who have signs and symptoms which are long lasting, who have long-term side effects of the chemotherapy. So one example would be their nails are discolored, they have their hands are blistered because of the chemo. Then you can use glutathione to help accelerate the healing of these long-term side effects.
No, because glutathione is commonly understood also as a very powerful antioxidant, right? Is that why people have this misconception that since it's an antioxidant, it will help in cancer?
Yeah.
How
I
does it
believe
actually
so. I
make
believe
cancer
so.
worse?
Yeah.
Are you familiar with the danger of what it does for cancer cells?
Okay. For cancer, I mean, cancer cells die because of free radicals as well. Okay, so one example on how we know that cancer cells die from free radicals is through chemotherapy and radiation therapy. These two. The immune system also kills the cancer cells by way of producing free radicals to kill them. Now, glutathione will counteract these things.
Oh yeah, I'm looking at some material now. It says that because glutathione is part of the process to help cells survive stress, and it can actually help the cancer cell survive harsher environments. So yeah, and again, if your immune system is not strong, and then you go and do this, you're helping the cancer side more than your own own immune system side.
Yeah. So you might argue, hey, our body produces its own glutathione. So you mean to say the body is actually even protecting the cancer cells? Yes and no.
Okay.
Yes, it is protecting because our body, having cancer, no, just by having cancer, you would have very high inflammation. So your body would work overtime to produce more antioxidants, namely glutathione, to counteract the inflammation, so you don't die immediately. Okay, so that's the one purpose. And another answer would be no, because um the body have regulatory mechanisms in ways
Yes.
that it will suppress antioxidant production because it needs to kill something.
Yeah.
Yeah. So there is a perfect balance of glutathione that is present in the cancer patient's body. Now, if you add in an extra amount of glutathione, so an exogenous glutathione, you would affect that balance. So you would tip the balance towards increasing more glutathione, and the cancer can take advantage of that and protect itself from the treatments that you are undergoing. Now, personally, in my cancer patients, do I use glutathione as a cancer support treatment or a chemotherapy support treatment? The answer is no. I don't use glutathione at all.
Because they're better options.
Yes, number one, there are better options. Number two, again, that will the glutathione will counteract the effects of the radiation therapy and the chemotherapy.
Yeah.
Yeah.
It protects both the healthy
Yeah.
cells and the cancer cells, right? It
Yes,
protects.
yes. Yeah. Now, what if, say, for example, the patient is not undergoing chemotherapy and radiation therapy, but I am using high-dose intravenous vitamin C on the patient. So the intravenous high-dose vitamin C is now acting as a pro-oxidant. Okay?
Yes.
I still do not use glutathione because the glutathione will eradicate the pro-oxidant effect of the vitamin C. So there is no situation where I use glutathione for a cancer patient, okay, who has active cancer. The exception would be a cancer patient who is in remission. But glutathione is not among my number 10, it's not among the top tools that I will use. It's one of the last things that I will use because a cancer patient who is in remission, sometimes the remission status is still questionable. Unless true. It's questionable, no, because how the patient got the in remission status is just by having a negative finding in the scan.
But it could be positive 2 weeks later.
But it can be positive 2 weeks, or there are microscopic tumor cells. There are microscopic tumors that's beginning to form that was not detected by the scan because it's still too small. And then in that sense, you still harmed. No, I won't say that you harmed the patient, no, but you still you still help the tumor, or you still help the cancer to grow. Okay, so glutathione I seldomly use. The only time that I would use glutathione is in this situation. The patient is in remission. I have 0 circulating tumor cells in a liquid biopsy. The patient is already has already finished treatment. Probably the patient is trying to recover from the long-term side effects of whatever treatment the patient underwent. So those 3 should be present in a patient. And by those 3, I mean strictly those 3. If one is missing, I won't use glutathione. Okay.
So to everyone, just to summarize what Dr. Jansen said, Dr. Jansen was mentioning that the mechanism of action for glutathione, yes, it is very high in antioxidant. It is potentially useful for counteracting chemotherapy and radiation therapy. But the important thing is, so there is information, pros and cons for glutathione. However, what makes us both agree on this program is that there are better choices where we are very sure there are only pros and no cons. So if given the option, why would we would just recommend something that that has no drawbacks? right? That is ideal for your condition, where we don't have to worry if you might have circulating tumor, but you didn't go for the expensive test you decided not to do the liquid biopsy, for example, and things like that. Then definitely the safest choice is the one that has no drawbacks, where everything is understood and is very effective anyway, right? And it probably maybe even more effective than glutathione. So this is where we are coming from. So we agree that there are possibilities where glutathione is an effective antioxidant. However, in the option of choosing something for a cancer patient, we won't choose it because we have better choices. Yeah.
That's some new insight. Okay.
I hope that as we speak, you are getting like understanding where we are coming from. So yes, maybe someone recommended glutathione to you and showed you research. So we agree with the research. The research says it's a very antioxidant, but it has its drawbacks, as Dr. Jansen highlighted, right? So there are options. There are other options which are even equally powerful and even more powerful and more effective, and they don't have drawbacks. So that's why we would say, why not take something which has no drawbacks? Nothing against glutathione at all. Yeah, all the research on glutathione.
Okay, next question, Ma'am Christina from Lipa. I have breast lump, and is biopsy necessary after getting a BIRAD 5 result from mammogram?
Yes, a
Wow.
biopsy is
Clear
necessary.
answer. Clear
Okay,
answer.
what is BIRADS 5? BIRADS 5 is malignancy.
Wow.
Highly suspicious for malignancy, or the characteristics of the tumor points to malignancy. Okay,
Oh, wow.
so a biopsy necessary at this point in order for us to know what kind of breast cancer you have. But okay, can you bypass biopsy? Yes. Now you have to talk to your surgeon. Okay, is there a way for you to undergo surgery outright? So just remove the tumor. Then after removing the tumor, then that's time that they go and study what kind of breast cancer you have.
That's
Okay?
a good topic to bring up
So,
later.
yeah, so this is possible. Okay, this is possible. I've had patients who had experienced this path. However, you have to talk to your surgeon if your surgeon will actually agree to this kind of plan. Okay, because not all surgeons agree as well. Okay, so it depends on what factors. It depends if the tumor is resectable or not. Okay,
That means
that's
it's
one.
operable or not, right? That it can be
Yes.
operated on.
Yes, that's number one. Number two, the size of the tumor. If the tumor is too huge, usually the surgeons would want to shrink the tumor first before they operate on it. Then in that sense, sometimes a biopsy, they would require a biopsy sometimes, no, in order for them to know what treatment you should undergo. Okay, so those are some of the factors. I haven't mentioned all. Ultimately, you have to talk to your surgeon in order for you to know if you can go directly to surgery, remove it outright, or you really have to undergo biopsy first. Then go for the surgery. So this thing. And if you don't have a surgeon yet, I would recommend talking to Dr. Jamie Katapia.
Yeah, I was about to say that. And I really want to thank this viewer. I feel so happy. Doc, I feel happy for tonight's program already, because I can just imagine if I'm the viewer and I ask you this question and you settle the doubts in my heart. Okay, I need to go for a biopsy, right? And you gave a clear explanation. And I heard the keyword. The keyword was high percentage chance of malignancy, which let's put it in layman's terms, means highly possible that is cancer, or almost sure that is cancer, right? So now Doc Jansen suggested, okay, so first of all, that made my night. It's like we helped someone. We really helped someone. The person maybe was just sitting on the fence, don't know what to do, right? And it's so nice to be able to help you decide. Give you the information for you to decide yourself, right? where to go. Next is what an interesting idea, or not idea, but what an interesting reminder that there is an option where if if you're ready to remove the tumor, right? You don't even do the biopsy. And Doc, I can think of one advantage, right? That one time you act very fast, so less time for anything to happen to the cancer, like spreading or whatever. Number two, people always ask this question, Doc, if I do a biopsy, will it cause my cancer to spread? And your answer is there's always a possibility, right? So if you go straight and cut it out, then you're not worried about it spreading because you've already removed it. Then after that, you can do a biopsy on what is removed to let you know what is it exactly was it. If it turns out that it was benign, well, you removed a tumor. And if the operation was successful, there's no real downside, right? But if it was cancerous, confirmed malignant, then you just did something very quickly, and that definitely will boost your survival rate and your success rate against cancer. So what a great insight of another approach to dealing with a tumor that is operable. Yeah.
Okay, we're almost at the end of tonight's session. This will be our last two questions for the evening. Next is from Vicky. When is lumpectomy usually recommended over mastectomy?
Oh, you have to ask a surgeon. You have to ask a surgeon. Yeah, I'm not a surgeon already, so my answer would be I don't know.
Yeah, that's a perfectly fine answer, right? Because we're trying to give our opinions and information medical, so we want to give things that we do know. Here's a good news. Additional, we're going to Doc. I think Jhen will be calling you or Beth will be calling you to confirm your schedule availability. We want to do a SM Max in June. All right. So this time we hope to. So Dr. Jimmy, we want to get Dr. Jimmy there. So one of the best surgeons in Metro Manila is going to be able to answer all your surgical questions live, all right? And Dr. Jimmy will be there, Dr. Jansen will be there. Hopefully this time around we'll try and get Dr. Johan so that he can share about pure food side of things. It'll be fun. So everybody look out in June. It will be in Bonifacio Global City. It's gonna be a SM Aura. It's a very nice mall. We will probably do it on a Saturday morning. So after that, you can go shopping with your family. All right? Okay. Yeah, Jhen, why don't we go to our last question?
Okay, last question. From Angelito. How is CKD detected? Is frequent urination a symptom of CKD?
Okay, very good question.
Very good.
Frequent urination is not. It's not at all. It's not actually related even to your kidney function. Yeah. Okay. Frequent urination, if a patient comes to me with that kind of complaint, no? So what are the diseases that I would be thinking of? So number one is UTI. Number two would be if the patient is a male, probably the patient have issues with the prostate. Okay, number two. Number three, diabetes. Diabetes can make you urinate really frequently.
Especially at night.
Mechanism for diabetes and urination, Doc.
And it's chemistry, osmolarity. Osmolarity. So for diabetic patients, their blood is more hyperosmolar. Their blood is more hyperosmolar because of the high sugar levels. So during the kidneys filtering the blood, no, the sugar
more water will come out.
Yes, more water will come out. So how? It's because the glucose is actually remains in the urine. It's not being filtered by the kidney. No, I will rephrase. The filtering capacity of the kidney is not enough to remove all sugar from the urine. So the urine then is more concentrated. So if the urine is more concentrated, it will retain more water. Actually, it will even attract more water.
Wow.
So if it attracts more water, then more fluid will go into your urinary bladder to be eliminated through
It will trigger you to wake up and go urinate in the middle of the night.
Yes. So that's one sign. So those are the few diseases that I will think about. No, not really problems with your kidney function. Now, for CKD, how do we detect it? Simple. Just through a blood draw. If your creatinine is high, then that's a sign of kidney problem.
But what about
Number two.
Yeah, I'm sorry.
What?
GFA.
GFR.
GFR.
Sorry.
Okay, GFR. Okay. Here's okay. We're talking jargons already, no? So you have creatinine, serum creatinine. Yeah. So creatinine is found in your blood. Okay. So we get a blood draw. We check your creatinine. So creatinine is a protein. Wait. Yes, it's a no. Wait. Yes. I don't know. Creatinine is not actually. Is it a protein? Actually, yes, it's actually a protein. Yeah. So creatinine is a substance that is secreted by your muscle. So creatinine passes through the urine unhindered. It cannot be filtered by the kidneys. So if your kidneys would have a decline in kidney function, then the creatinine in your blood will accumulate because you are now eliminating less of them. Okay? Now, creatinine is just an indirect sign of your kidney function because there are also a lot of other factors that can increase creatinine even if you have a normal kidney function. One example would be if you have muscle breakdown. Say, for example, after a very strenuous and prolonged exercise. Or if you just got beaten. Okay? So muscle breakdown will increase creatinine even if you have a normally functioning kidney. Now, the direct measure of kidney function would be your glomerular filtration rate. So the word glomerular sa tongue twister, no?
Yeah, tongue twister.
You know, I've been a doctor for how many years already? Almost a decade. Still, I have these terms, you know.
Difficulty with these tongue twisters.
It's like tongue twister, difficult to pronounce words. So glomerular, that term is to describe the glomerulus. The glomerulus is the actual filter of the kidney. Okay? So the glomerular filtration rate is the direct measure of how well your kidney is functioning. And we can measure that by way of the creatinine. Creatinine clearance. Okay? So for CKD, no, that's what we measure. So if your glomerular filtration rate is going down, it means that your kidney function is going down. So if your kidney function is going down, your creatinine would go up. Okay, so that will now reflect on the different stages of CKD.
Oh wow!
Of a chronic kidney disease. Okay, so that's how it is. That's how we measure CKD.
So, Doc, the most because creatinine can also be affected by other conditions, right? So between GFR and creatinine, which or is it always both together that you see a correlation to confirm that you have CKD, or is it really GFR and the different levels of GFR that CKD is classified with? Doc, I asked this question because Doc, this trip to Singapore that I just came back from, I found that it is now in the common people's conversation, CKD. In the past, we always talk about dialysis. So we never talk about CKD. We just talk about kidney failure, right? And then we have a lot of charity shows that raise money for dialysis foundations, right? Because it's expensive. But today, now the keyword that is being spoken and a rising incidence rate is CKD. So it seems like more and more people have not reached the kidney failure side, but already really pretty standard across the board that they are experiencing CKD. So yeah, back to that question. I mean, do you see that trend here in Philippines as well? And of course, back to the question, which is the thing that if you suspect yourself or you're worried if your kidney is your kidney going through any damage, what is the 1 or 2 tests that they should go to at maybe the nearest high precision or whatever to give them a ease of mind that they're okay or not okay? Yeah.
Capillary filtration rate
Mm.
is also affected by the age of a patient.
Okay.
Yeah.
Okay.
So it's best to interpret these two together. So that's one. Another one that I would take a look at is the amount of protein that you're actually peeing out. Yeah, so
Okay.
that would be urine microalbumin test and the urine protein to creatinine ratio. So I
Is that-
usually look into that.
Is that normal in CBC or no? You have to
No,
specify.
no. It's a separate test that I have to specify if I request for it. Yeah.
Okay.
And
All right.
in terms of trend, the answer is yes. There are more and
Wow.
more people nowadays who are having CKD compared to decades ago.
Why is
Back
that?
in the 1990s,
Diet.
the food that we're eating,
Really?
because of so much processed foods that we're eating, it's because of that. And salt is practically everywhere. If you take in too much salt, that can damage the kidneys. Also, another one, certain individuals are living a more stressful lifestyle nowadays. So they tend to forget to drink water because of how busy they are
Yes. Okay, it's my
with
problem.
work.
So yeah.
Yeah, actually, I am also guilty of that. So I am making sure that I am able to drink at least 4 liters of
Wow.
water every day. So that's my goal. That's really my goal, no? So for those of you who are watching, no, our topic tonight is CKD. So the one thing that you can do right now in order to prevent it from happening is just making sure that you're well hydrated, regardless of what diet that you're following.
It's
Yeah,
gonna
regardless.
it will help a
It's-
lot. It's
Yeah,
gonna-
it's really hydration, especially we are living in a tropical country, and all the more that you have to make sure that you are well hydrated. And according to some news outlet out there, it's the Philippines has one of the worst work-life balance.
Huh?
So I don't know what that means. I don't know what
Okay.
that means, but
Maybe it's because amount of time stuck in traffic lang.
probably so. That's
Yeah.
actually also one another factor. So us Filipinos, no, we usually want to prepare for our day ahead, and you're gonna die if you suddenly need a toilet, especially for ladies, no. And the Metro Manila, it's not like
Yes.
other first world countries where you have very good public toilets. In Manila, there's no such thing as
You can
public
look at
toilet.
Doc's face. Very strong reaction.
Yeah, so it's how it is. It's how it is. So I'm not actually seeing more and more patients who have worsening kidney function because of this. So do yourself a favor, make sure you're able to drink plenty and plenty of water. 8 glasses is not enough.
Oh wow.
8 glasses is not enough. You have to surpass that because your glass may be this big.
Okay, very small glasses now, right?
This big.
And if you're
Yeah,
taking
so,
maintenance medicines, additional 1 glass water per pill.
Yeah.
Wow.
So there you have it. Jhen is a pharmacist. I didn't know that, but there you go.
Wow. Okay, that's a lot of water. Wow. It just shows no wonder our CKD rates are going up because almost all of us are not fulfilling the minimum requirement of amount of water that we should be drinking. Wow. Doc, I think we've come to a close of tonight's program. I just want to throw something, Doc, to you, which is really interesting and very scary. Right? I was talking about vaccines with my sister yesterday, and then vaccine apart because it's related because many people suspect it's related. But anyway, here's the scary thing. She spoke to a few of her friends who are grade school teachers, right? So in a class of 20 students, only 5 are normal. The rest have some form of ADHD, or some learning disability. This is for grade 1, grade 2. So I think, wow. So I'm not sure. I think that's just I just think that that's very scary, right? Is it because of the food that our children? I mean, a grade 1, grade 2 student is 6 to 7, or maybe even 8 years old, right? That's the age group. Out of a classroom of 20, only 5 are like really completely normal. The rest have some form of learning disability, ADHD, or maybe even mild autism. I think that is phenomenal. Very, very scary thing. So, Dr. Johnson, our food nowadays is really, and I'm also wondering, is it because of the pandemic? Because if you're 6 or 8 years old, it's really, you grew up during the entire pandemic, vaccination, COVID-19 and everything that. So just something to watch out for. Yeah, I sorry, just to bring that up, because I just want to bring back to the topic. Be careful what you eat. It's really very different from our Lola's days. Maybe even the Jeep, what Jolly Jeep food 20 years ago is more healthy than the fast food restaurants that we eat today. Yeah. Yeah, Jen.
Okay, there's still last
Oh,
question.
one more last question. Okay.
Yeah.
Yeah, very
From
productive.
Elvira Vertudazo. Good evening. If you have benign cyst on your breast and have a hypothyroidism, a hypertension, what will you recommend kind of PPARS should be taken? Thank you.
For this, usually, depending on how big the cyst on your breast is, I would advise the tablets, always the tablets, and either the powder or the liquid. Yeah. So depending on how big the cyst is, if it's insignificant, then you don't have to worry about that. Actually, it doesn't have to be dissolved. No, the cyst. It's okay. I would worry more about the hypothyroidism and the hypertension. So for that matter, then Softgen and the tablets would be enough. Yeah.
Okay. There's one more last question from Ms. Minda Vanella. Can PPARS help to treat osteoporosis?
Oh.
Osteoporosis, no, because osteoporosis is a disease of number one, for bones. It's also a lifestyle disease. It can also be a side effect of other medication, okay, that leads to osteoporosis. So PPARS, sad to say, no. There are other supplements and medications that we need to help combat osteoporosis. And to fight osteoporosis, the most important one is actually exercise. Okay, especially resistance exercise.
Yeah, because people with osteoporosis always take calcium supplements, but your body doesn't absorb and use it to strengthen your bones unless you actually put your bones under stress, right? This all I learned from Dr. Jansen. So for our regular viewers, I think many of you can try to apply for lifestyle coach certification.
Okay.
Oh, that's our last question already,
it looks
right?
like we've covered all our questions.
Okay.
Yeah. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Doc?
I'll go first. So thank you everyone for attending, and thank you for asking those wonderful and interesting questions. And by interesting, I mean we also learn a lot from the questions that you are asking, okay? Because we get to know who you are, your case, and how we can help you. All right? So if you really need a definitive help, no, because this webinar, this doesn't constitute any kind of consultation or medical advice, okay? I have to see you. I have to hear your story, and from there I can make the appropriate recommendation. All right. Now, tomorrow is no, not tomorrow. Actually, tomorrow I'll be going to Malaysia to attend a conference on precision oncology.
Wow.
Actually,
What is that?
the term is precision. Actually, the proper term is precision metabolic oncology. So this kind of oncology is already in precision medicine or personalized medicine. So
Okay.
the a lot of doctors would be talking about how they analyze your genes, and from the gene analysis make the appropriate recommendations, appropriate treatment recommendations. So they make sure that the treatment is effective for the patient, and we're actually giving the right treatment for the patient and not just for the cancer. Okay, so exciting weekend ahead. Next week, I'm going to share some learnings that I will be getting from the conference, and so stay tuned. No, next week, yeah, especially for
I'm
those of
looking
you who
forward to
are cancer patients. Yeah,
really
so
looking forward.
so I'll give the floor to Sir Shyan. Thank you, everyone.
Okay. I don't have much to add. Like Dr. Jansen, I just want to thank everybody. We are now 203 or 4 episodes already. So if you
205 actually.
205, so if you work that's like 4 years of this program being on every single week. I think in the last 4 years we have only missed 1 week. So a big thank you to everybody, and yet it's still fresh. You see, me and Dr. Jansen, we seem today maybe we're talking about non-cancer. We are smiling a lot more, and our energy is still up. So you can tell that we do enjoy your questions, and like I said tonight, I was really happy to be able to that we were able to help a few viewers, give them enough information for them to make a decision, right? Again, go and see your doctor, because don't take this kind of program as a consultation. This type of program is to help you answer the questions so that you know what to do for the next step, and work with your primary physicians on that. So with that, I just want to wish everybody have a great weekend ahead. We're going to talk about cancer again next week, I guess, right? So we'll answer more cancer patients. Well, we did answer some cancer patients today, and I hope that we've shed some light on CKD. CKD is very important, everybody. Like I said in the video, once your kidney is destroyed, it can never be regenerated, right? It can't, you can't make new kidney cells. So take care of your kidneys. You only have these two, and they will have to last your entire life. Good news is that you can even survive on 1 kidney. But can you imagine, your body can survive on 1 kidney, yet God gave you 2. That shows how important it is, all right? So do take care and don't lose hope. Even if you have CKD, we can stop the progression. Like I said, a person can live with 1 kidney. So imagine you have 2 kidneys and one is 40% damaged, you have the spare, right? Just stop and make sure it doesn't get worse, all right? And you will have a healthy, normal life. So wishing again, everybody, a good weekend ahead, and I'll see you guys next Thursday.
Yes. Thank you so much to our experts, Mr. Shyan and Dr. Jansen, for sharing their expertise and insights. If you have any follow-up questions, don't worry, we will answer each of them next webinar or via direct message. So next is, are you feel the heat? Because the Lazada 4/4 Summer Sulitipid Sale is starting tonight, April 3, 8 p.m. until April 6, Sunday, featuring our Power Pack, Stay Slim, and PPARS capsules. Also, don't forget to check out our official website. That's www.simplynature.asia for exclusive promos such as, number 1, free shipping all day tomorrow, April 4, Friday. Okay, number 2, get 7 free sachets of Cleansing Plus for every purchase of either PPARS liquid or powder extract. So that's 1 week worth of detoxing. And lastly, get 1 free blister of PPARS soft gel capsules worth 3,700 when you buy a tri-pack. And we hope to see you again next week for another empowering session. Same day, same time, every Thursday night at 7:30 p.m. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we are always with you from start to healing.